Welcome. My name is Natasha Sherman, and I am your host. And my guest today is Jenny Allen. We are doing a continuing conversation. Jenny is a magazine writer, writing profiles of people in the arts, and more recently, humor pieces for The New Yorker. She is also a contributing editor to Good Housekeeping magazine, and she has 2 essays in a new anthology, In the Fullness of Time, 32 Women on Life After 50. Jenny lives in New York with her husband, cartoonist Jules Pfeiffer, and she is also an ovarian cancer survivor and wrote and performs a one-woman show called I Got Sick, Then I Got Better. And she's here today to continue our conversation about her story and to do excerpts from her one-woman show. Welcome back.
Thank you, Natasha. I'm thrilled to be here once again.
So, one of the things we haven't fully talked about is, there's always something to be learned from somebody else's experience, particularly when you're sharing it in such a powerful way. And one of the things that is often daunting and confronting are the relationships with physicians.
Yes.
And I understand you've gone through the gamut.
Yes,
and
I feel that I have.
So what do we have to learn from it? Like, what would you tell people?
Well, I really would. I have thought about this a lot because you only come to things with what I only came to it with the experience that I had. When you have this kind of cancer, you must take care of it right away. So you are thrown back on your own. What's that expression? Thrown back on your own devices?
Devices, I think it is, yes.
As it were. Something that I did do right, I think, was to, I didn't go to the first surgeon or that I spoke with. I just didn't, he was really uncommunicative. But I did feel in my haste that since I'd spoken to one guy, I thought, that's enough, I have to take the next person.
I only get one elimination.
I only get one elimination, and they got to do this operation next week. So I did go to a woman surgeon who was at a famous hospital, and I liked that about it, a really good cancer hospital. But she was very cool, only I thought I'd used up my discard pile,
right.
And I feel that I should have been a little, I could, even though I was in a kind of a swivet about this, I knew that and trying to be, and was in a rush, I probably should have asked a friend or a loved one to be my brains for me.
And what really, a great thing, yeah.
That is, and that would go also as well for any visits, pre-surgery, after surgery, follow-up visits. That my friend who had ovarian cancer put it. What did she say? You get amnesia. You have doctor visit amnesia. You even bring your questions. You've written them down. That you talk to the doctor. You get up and walk out. You can't remember anything he said, and this. And she herself was a dentist, so she was a medical person too, and it happened to her. And I used to think, it was really in retrospect, because I thought, you need a nice thug to go with you.
Yes,
somebody who is a really pleasant person, but will do, if the doctor says to you, listen, I really have to go now, it's not you saying, could I just ask one more question? Because you want to be really nice to the doctor who's going to cut you open. You don't want to get in trouble. But the other person says, I'm sorry, we have another question. We need you to wait. And that when if the doctor says, but I'm really in a hurry, surely you can take 30 seconds. That you have to meet some of these doctors, and even if you end up having quite a few doctors, and some turn out to be great, or you can move on to great ones, but if you are, when you have a disease like this, you tend to have several doctors, and you need them to listen to you. And you can't do that for yourself. It's like being a writer also trying to be the editor. You can't do both jobs. Your job is to be the sick person and that's a big job.
And showing up.
And showing up and dealing with your kids and all that, it's like, I used to call it a nice thug, that they can, if they need to, even go to the door and say, I'm sorry, we really want to, because
I love it.
Yeah, that the doctors will respond to that.
Did you ever get a nice thug, or did you learn that lesson after the fact?
I think I learned it after the fact. I didn't want, my husband doesn't, gets paralyzed about medical things. My dear friend, I could have asked her, but I didn't want to bother her. I would have I knew several people who would have jumped at the chance, I think.
Yeah.
But I was bashful. So I would say, in retrospect, that you shouldn't try to learn everything. I had a dear friend with breast cancer, and she's fine now. She brought her great friend Robin, and Robin had done this for her mother. Robin had a notebook. She wrote down everything the doctor said. She wasn't obnoxious about it or challenging them, but
she was efficient.
She was really efficient, and they knew that they had to explain everything to her.
And what you said was that you, in retrospect, you had some friends that you thought probably would have been up for that. And I think if people look in their lives, we all have someone like that.
Absolutely.
Who would love to do that job and be your,
and be
nice
proud
thug.
of it. And it would be the thing that they could do. People wanted to do things.
Yes.
And that would be the thing that they could do. So I would do that differently next time and not be bashful and not say, I'm sorry, do you have 3 hours to ask my friend? Because you'll find a friend if you give them enough time, even in New York where people are busy. If you say, do you have 2 hours? I really need help with this. It's usually the busiest people, too, as they say, right?
Yeah, that's really good advice. I think also for me, what I hear in that is, like you said, you thought you only get one discard, and so you want to give yourself permission to get as many discards as you want.
Absolutely. I knew women that just kept at it till they found the great doctor I was telling you about on our break, who talks like this, but he's the genius. And I wish I'd forged ahead to him. I thought, and again, there was the constraint of time, but there's also this nice girl thing where you think, people are going to start thinking there's something wrong with me if I've turned down two doctors.
And you're in a vulnerable position.
Oh
also,
my God, so vulnerable.
As you said, there's someone who's going to cut you open. You don't want them to dislike you.
Oh my God.
That's
yes, that's really true.
The thing that some people say that I disagree highly with is that doctors are trained to keep their distance and not get emotionally involved. And I say BS to that, really.
I say BS to that, too.
I want my doctor to know me and to be fully engaged. And it doesn't mean that I expect him to come home with me.
No.
But
and they're not mutually exclusive.
Yes,
these two
exactly.
brilliant guys who are my doctors now, and I just love them so much, are these incredibly loving, approachable men. And I never feel that because they're nice, it's taken IQ points off.
Yes.
And they're known for being brilliant guys. One is
Yeah.
brilliant researcher, the other's a brilliant surgeon. And you don't have to be a cold person to be a surgeon.
No, not
and
at
their
all.
humanity brings them great, it is good medicine.
Yes.
It's smart,
Totally.
good,
Totally.
efficient medicine to be kind.
Yeah, really good. I wanted to ask you, and then I want you to do another piece from
a
your
little
show.
bit. Yeah.
But I wanted to ask you, you have 2 daughters who are young women and who I can't even imagine what that's like to have to share that with them, to not only, like, how much do I tell them, how much do I share with them about my fears, and then can they express their fears? How did that go?
Well, it just went as, I think we all did the best we could. I really didn't want them. One was quite young, like 10, and one was 10 years older, 20. So one was in college, and I felt lucky about that because I was grateful that she wasn't. I wanted both of them to have. I didn't want this experience to be the experience that ended their childhoods or their youthhoods, their maidenhoods or whatever. I didn't want there to be a before mommy got cancer and after mommy got cancer. I wanted them and I didn't want to ruin my daughter's last year in college. And the 10-year-old, you know, who wants to? I hoped that she would, you know, I didn't want death to seem near to her. So I did present it to them. I think in the show I say a kind of bump in the road. I told them I had cancer. I told them that I was having surgery, and that the doctors were very hopeful. I was upbeat about it, and I hoped that they wouldn't go on the internet. I think they protected themselves as well, because I didn't say don't go on the internet, but I don't think I had to. I think they really didn't want to know any more than they knew.
Did you find yourself relating to them in a different way, like thinking, there's so much I want to say, and time is short, and
oh my gosh, it was so, well, you know, also your body, you go into total menopause right away.
Right.
So your hormones are crazy, even if you, as soon as, you know, after you have a hysterectomy. So it's a very emotional time, in addition to the fact that you don't know whether you're going to, every ache and pain, you think, it's back, and they didn't get it. So you kind of have a little post-traumatic stress disorder,
yes.
but you're still having the trauma. So, but you're trying to be a mother, and you're trying to hold it together. And I found myself tearing up several times a day when I would think, gosh, I forgot to tell them something. I forgot, and I had this in the show, and I think we cut it because it was a little long, but I would think, I'd write down things like I never taught them. I'd say, oh my God, I never took them to the neighborhood where their father grew up in the Bronx. I never told them exactly who of their cousins' died in the Holocaust. I never taught them, made sure that I taught them that they should strip the bed when they stayed at somebody's house for the weekend. Did they really know how to set a table? Do they remember to write a thank you note? Well, that I had this limited amount of time in which I wanted them to know, I wanted to pass on everything, and this made me feel sad all the time, and brought up short, because I thought, and I have this, I think still is in the show, about, I would think over and over in a morbid way, but you know, and the morbidity passed, but I would think, I'm going to die and I'm going to miss them. I kept thinking, and I thought, well, I guess I do believe in something after death, because all I thought was of me watching them have their life, but I couldn't talk to them or see them, but I would just miss them so much. And of course, and I didn't worry about them being incapable or needing me. I thought they would, I hoped they would miss me too. But they're both really competent people. And I never worried that they would be broken by this. I thought they would be sad.
Wow, that really says something.
Yeah, I just thought, I never thought, I've had friends who, when they think of their own death, think of their adult children having a problem and not knowing what to do. I always think my girls are going to work their way out of a problem. I just
wish you were there.
But wish I was there, and I would wish to be there.
Yeah.
But that was very hard for me to, and I did to take my 10-year-old, you know, trying to give her a great birthday. We went to that place, that huge water park in the Poconos, and we took like 10 of her friends, and we rented a car, and we stayed overnight in the hotel, and I just watched her on these water things, thinking, oh my gosh, I remember standing there trying to have this great time, thinking, I'm gonna die, and I'm gonna miss this child so much, and she's waving at me, and everything was an opportunity of very emotional for me. Yeah.
And it's so amazing to get through that, and to allow yourself to get through that, and then get to this point, you know?
It feels better now. And
yeah,
I think
I'll say.
if I get sick again, it wouldn't hit me upside the head as it did, with such ferocity, because that just took my breath away. That it just took my breath away. I think I would be terribly upset.
But not in the same state of shock.
Not in the same state of shock, no.
There's a part in your, and I hope we have a chance to just talk a little bit about the wig process.
Oh, yes, the wig process.
But there's a
favorite.
part of your show that is called Chemo Suite.
Yes, yes, yes.
So I was hoping you could do a bit
may
of
I
that.
do it?
Yeah.
Oh, thank you. Because we were talking earlier about the Chemo Suite, and a surprisingly welcoming place it was. So without further ado, let's see. I started chemo as soon as I recovered from my hysterectomy. Now, the area where you get your chemo is called the chemotherapy suite. And you have the treatments in these little rooms with a curtain in front of them. And they're very nice. They're almost cozy. They each have a TV here and comfortable chairs for your visitors. And everybody gets their own phone. And and there's a nurse's station down the hall, and right next to the nurse's station is a little kitchenette which has soda pop and little cans of juice and packets of graham crackers. And if you're there during lunchtime, they bring you this nice white box, like a present. It's a box lunch.
Uh-huh.
It's very civilized. I'm all adrenalized to be upbeat. Also, in case I'm allergic to the chemo, I'm on steroids, so I'm like, wired. And I actually don't mind those chemo days. I have my own lazy boy style recliner, and Jules, my husband, comes with me, and he sits with me, and he reads Cindy Adams out loud from the New York Post, and brings me these delicious slices of chocolate cake from the gourmet deli downstairs. Mm-hmm. And we watch Ice-T and Mariska Hargitay in Law and Order Special Victims Unit. Love that.
Uh-huh.
Unlike the rest of my life, I don't have to do anything. I feel the way I felt when I was pregnant. I'm doing something important, just sitting in a chair. And the nurses are incredibly cheerful in the best and not at all annoying way. Many are Irish, and some are Irish from Ireland. How are we today, darling? While I'm getting my infusions, the nurses just dance attendance on me, checking me every few minutes, bringing me fresh cotton blankets and pillows. Mm. I feel pampered, like I'm in one of those rooms at Elizabeth Arden. And I tell the nurses, I think they should get somebody to give pedicures to the patients, because we are literally in the perfect position, just lying here all day in our recliners. And they say it's a great idea, except that this being New York, there would be liability issues. I am not sure why I didn't find the chemo suite depressing. It was filled with women, mostly bald, their colorful scarves and jaunty caps only highlighting their baldness. I was bald too, of course, but I somehow felt that my baldness didn't look sad on me. When I took off my scarf, my few wisps of hair would stand up straight. So I looked just like a dandelion going to seed, which I thought was funny. And all of us were hooked up to these big, clear plastic bags of chemicals. I thought we were all in a great place. We were all getting the help we needed here in the chemo suite. We were like a sorority, and I was the eager new pledge, I smiled at my fellow patients. I gave them little waves. The patients smiled back, some of them kind of wanly, probably hating me. But I wasn't acting, I really felt good. And I really felt good. Let's see, how does it go after that? I wasn't acting, I really felt good. And when the chemo would course through my veins and I'd feel chilled, I'd think, well, this is a little creepy. This is a little like being dead and having embalming fluid pumped into you. On the other hand, bring it on. This is saving my life. I love the chemicals. I felt like Keith Richards in the 60s getting those transfusions of new blood to replace the old, tired, heroin-soaked blood. Oh, that's about all I could go on.
Great.
Yeah.
I didn't realize the chemicals felt cold.
Oh, I didn't either. That's why they do have blankets.
Ah.
And you can feel them going through your system. And I did think, man, people say, you know, chemo is this toxic poison stuff, but all I just kept thinking was, go get it, go get 'em.
I think that makes a difference. I think that makes a huge difference.
I was so grateful
not
to the
resisting
chemo.
it. Yeah.
I didn't resist it. I didn't understand why women, I mean, I don't mean to sound short-tempered, but the fact that women found losing their hair so upsetting, excuse me, was a little mysterious to me. I thought, now here's an equation: lose your hair or die. Well, forget. I don't care about the hair.
Right.
I mean, it's a little alarming not to have it. Even more strangely alarming, because nobody tells you, is to lose your eyebrows.
Wow.
I didn't cry when I lost my hair. I cried when I went, for a moment, when I went to the wig person, and I looked in the mirror, and I saw that I had lost my eyebrows. Or they had turned like these little white, blonde, hardly anything, like little baby, invisible baby ones.
What about eyelashes?
And I felt so vulnerable. I felt like I'd lost a layer of skin or something. Like,
Wow.
Nobody told me about the eyebrow. The eyelashes, my eyelashes are so short anyway that,
Wasn't noticeable.
no.
Nothing noticeable happened. So tell me about the whole bald process and the choosing the wigs.
Oh, well, that really was funny because I went with my friend. You know, a wacky thing about insurance. Most insurance, including mine, but I believe almost everyone's, oddly enough, covers wigs for chemotherapy patients. And my insurance covered my wig, no problem. It was like $600 or $900. You can get the most expensive wig that you can. I didn't get the most expensive wig. I thought $600 or $600 or $900 was more than enough to spend. But you can, $2,000 ridiculously expensive wigs, most insurance will cover. But like mine tried to stiff me on one of my chemotherapy treatments. It's like, no, you didn't need this one. But no, the wig, fine, no problem. So you feel like you have to get a wig because
Right.
it's paid for. Why not?
Exactly.
So I did go to the wig store in New York, Manhattan, the one that was recommended to me. And the store itself should be in a play because they have all the pictures of stars, some of whom had breast cancer, who need wigs, some of whom just are getting wigs just because they're
Stars.
singers and stars. And then there's a few drag queens up there too who had to get their wig. And it's just very New Yorky and funny. And the guy fit me with a wig, and it took a while. And you go through all these, you know, first you get very playful, and you think maybe I could just do this blonde. I'll just get crazy while I have a
Right.
wig. No, and I did think about that, but then you just get a wig that looks. I got a wig that looked like my own hair as close as I could, and I got it in time to go planfully. I was going to go to my first big event that I had to go to post chemo, which was my dear friend's daughter's graduation from University of Chicago. So I wore my wig, and very proud to be dressed up like a grown-up lady in my wig. But it was a very hot day, very, very hot day, as graduations tend to be. And the graduation was outdoors under the sun. And a friend of mine, an editor of mine, happened to have a child graduating the same year. She had brought extra hats because she's really organized. So she gave me one of her sun hats to put on my head. And because we were all out in the sun, under the sun. And about halfway through this event, my wig was so hot and scratchy. I used to say it was like, I felt like I was wearing my cat on my head. Like, ooh, it was so uncomfortable and sweltering there that I thought, well, I got to give it some more air, so I'll take my hat off. So I took the hat off, and the whole wig came off with the hat. And I couldn't even look at the people behind me again. I just, oh my God, I felt so. So that was really the last time I wore it. I thought, and
So you just went around hairless.
I wore a scarf.
Oh,
I wore
okay.
a scarf, and some of my friends did send me their wonderful scarf. I wore the ones they sent me. I had a favorite scarf I wore, and just the wig thing was. But I couldn't do the wig. It was, but I put it in my drawer. Interestingly enough, I thought, I didn't expect this. I couldn't throw it away. I couldn't bring myself to throw it away because it was like, and I just, was it because I still don't know, because I thought I might need it again because it was so expensive. I couldn't bear to just throw $600 or $900 in the trash. You'd think I would just have thrown it away, but I couldn't. I've kept it in the back of my drawer. Maybe it's a powerful reminder, but I have other things, other really strong, like the baby clothes my daughter was wearing when my second child, when I adopted her. They're in a special place in my drawer, like positive, wonderful things. I don't know, that wig is still in there, and every time I open the drawer and I look back there, I think, there's a cat in my drawer. I don't know, a pelt, some dead thing is in my drawer. Can't seem to throw it away.
Can't throw away the pelt.
I don't know why that is. Maybe one day.
Yeah.
I just feel hot just looking at it, but it's a powerful reminder.
Yeah. And how did it impact your relationship with your husband?
Well, he doesn't like to hear this, poor guy, but and I do talk about it in the piece. Did I do something bad here? I think it was very, very, really hard for him to be, some husbands, and it's no measure of what good or bad person they are, it's just their nature. Some men are caregivers, and some like to be cared for.
Yes.
And our MO of our marriage had really been that I did that, was do the meals and keep track of the house and try to keep the circle of family and friends, kind of maintain that.
Mm-hmm.
And I think he just it was really hard for him. And he really worried. But I think he didn't know what to do. And I wish that he had friends who had I think he kind of isolated somewhat. And I think he probably felt pretty helpless. I think he kind of froze in the headlights a little bit. I think he did the best he could, but it wasn't. I would certainly not say it was a bonding experience. Have I said enough?
Yes.
Yeah, I would say.
And
although a lot of women in the audience relate to this.
Yes.
I get so many women afterwards saying, that was my experience also with my husband.
Yeah.
Women who bring their husbands,
Yes.
It's like it's
Certain people are capable of certain things, and they just aren't of others. And I think
and
it's
it was
what you
my fault to think. I also kept hoping that he would
show up in the way you wanted
show
him
up
to
in the
show
way I
up.
wanted him to show up, and I should have said, this is where you can, if you keep your wits about, you can say, that's not going to happen.
Yeah.
So who is going to help me with that?
Yeah.
Who can be that person? I got to anoint somebody or beg somebody.
Yeah.
Or not feel so guilty about asking somebody to do that.
It's like getting your good thug. You get another person on
Absolutely.
your team who could fulfill that role.
Who's going to
rather
call the
than-
doctor
yeah.
back and bug the doctor and tell the neighbors to stop with a bloody construction because my wife just had chemo and she doesn't feel that well today.
Yeah.
Could you stop? You
Yeah.
know? And and that didn't happen. And I couldn't ask my kids. And but I bet
Yeah.
there would have been a friend or two who'd
Yes.
been happy to be that person.
We have, unfortunately, just a minute left.
Oh, geez.
And I want to ask you, is there anything that you would want to say that you think is important for people to hear or might be useful or?
I think that, I guess it's such a scary diagnosis that but you don't, there are a lot of great statistics out there. One doctor said to me, don't go on the web, don't ever go on the web. Now that's not realistic because of course you want to go,
Yes.
you want to find out. But your cancer may not be her cancer, may not be that cancer. Before you go to, I would have, I guess my advice would be about this, as I seem to be thinking that people have tons of friends. But whoever that thug person is,
Yes.
or that nursey person,
Yes.
get them to go on the web for you. Because no matter what, with me, when I went on the web, I did, every site I went to was like, the worst.
Yes.
Get them to go on and do specific, really good specific research. Somebody who's going to be tactful and going to
Yes.
be hopeful.
And I think that ultimately is be really clear in your request. Like, this is what I would want and this is how I would want it to look.
And that's so hard for me to not pussyfoot around.
So we are out of time.
Oh,
thank you so much.
Thank
so much.
you,
It's been
Natasha.
wonderful.
It's
Thank
wonderful for me. I love it.
My name is Natasha Sherman. Thank you for joining us.
Okay, when are we going to do parts 10?